I will speak about the casts in the urine. Casts in the urine. So this is the first one. This is what? This is RBC's cast. RBC's cast. RBC's cast. Then this is the second one. This is what? This is the white blood cell. White blood cell cast. White blood cell cast. Then this is the third one, which is called what? Granular or muddy brown cast. Granular muddy brown cast in acute tubular necrosis. Acute tubular necrosis. This is called what? This is called the Maltese cross. Maltese cross. Maltese cross in fatty cast. Fatty cast. Fatty cast or oval fat bodies. Oval fat bodies. Fatty cast. Fatty cast. And this is called what? This is called the hyaline cast. Hyaline cast. Then again. This is called what? The RBC's cast. This is called what? The white blood cell cast. White blood cell cast. This is granular muddy brown cast. Granular muddy brown cast. This is so important. And Maltese cross sign in fatty cast. Fatty cast. Then this is called what? This is called the hyaline cast. Hyaline cast. So the first one of them is what? There is what? Casts in the urine. Casts presence of cast indicate what? Indicate it's a glomerular disease, renal tubular origin. Why? Because this cast will take the shape of the tubule or the glomerulus. So glomerular renal tubular origin. So it's hematuria biuria. The origin of them is what? Glomerular or renal tubule. So it will lead to formation of the casts. But if the origin is what? Bladder cancer or kidney stone, acute cystitis, there is no casts. So in case of bladder cancer or kidney stone, there is what? Hematuria. Acute cystitis, there is what? Biuria. So hematuria, blood in the urine. Biuria, pus in the urine, indicating infection. White blood cell. So acute cystitis, there is what? There is biuria. No casts. Bladder cancer, kidney stone, leading to what? Hematuria. No casts. So we have here the first one is what? RBC cast. It will indicate what? Glomerulonephritis or hypertensive emergency. Then the second one, this is the second one, white blood cell cast. It will indicate tubulointerstitial inflammation, acute pyelonephritis, transplant rejection. So white blood cell cast will indicate what? Tubulointerstitial inflammation, acute pyelonephritis, transplant rejection. So you must remember acute pyelonephritis. There is what? There is white blood cell cast. So RBC cast is this shape is what? Glomerulonephritis, hypertensive emergency. Then white blood cell cast indicating what? Acute pyelonephritis. Is this shape, white blood cell cast, acute pyelonephritis, and transplant rejection, and tubulointerstitial inflammation by many drugs, achieved by many drugs. So tubulointerstitial inflammation and acute pyelonephritis in case of white blood cell cast. Then granular, this is the main one, granular or called what? Muddy brown cast. This is the granular muddy brown cast. In case of what? Acute tubular necrosis. This is so important. So granular cast, muddy brown cast. This is the granular cast, muddy brown cast in case of what? Acute tubular necrosis. Then the next one is called what? Maltese cross sign in case of what? Fatty cast. This is fatty cast. Maltese cross sign, fatty cast, oval fat bodies. So in case of what? Nephrotic syndrome. Then the next one, waxy cast. This is so important also because it will indicate chronic kidney disease, end stage renal disease. So waxy cast indicating of what? End stage renal disease, so important. Chronic kidney disease, so important. Waxy cast. So fatty cast indication for what? It's what? Nephrotic syndrome. Maltese cross. Then we have waxy cast, end stage renal disease, chronic kidney disease. then hyaline cast, hyaline cast, hyaline cast. This is what, this is normal, this is non-specific. It can be a normal finding with dehydration, exercise, or diuretic therapy from what, solidification of what, something called the TAM horseful protein. TAM horseful protein is called the uromodulin. So there is solidification of TAM horseful mucoprotein, solidification of TAM horseful protein. So this protein is secreted from what, from the renal tubular cells to prevent urinary tract infection. So the renal tubule will secrete TAM horseful protein in normal condition to protect itself from urinary tract infection. But if there is solidification of TAM horseful protein leading to formation of hyaline cast, in case of what, solidification of TAM horseful protein, in cases of what, case of dehydration, exercise, or diuretic therapy. Then the next one, nomenclature of glomerular disorders. So we have what, we have focal, diffuse, proliferative, membranous, primary, from the glomerulus itself, primary glomerular disease, secondary to another cause, secondary glomerular disease. So we have the focal, the difference between the focal and diffuse. Focal less than 50, diffuse more than 50 of the glomeruli. So less than 50 it's focal, more than 50 it's diffuse. So focal, so it's called what, focal segmental glomerulosclerosis, focal segmental glomerulosclerosis. Diffuse proliferative glomerulonephritis, diffuse proliferative glomerulonephritis. Then proliferative like what, hypercellular glomeruli. In case of what, there is a difference between two diseases. One is called membranous, the second one called what, membranoproliferative. So membranoproliferative has what, the hypercellular glomeruli, so it's called proliferative. But membranous, so there is something called glomerular basement membrane between what, glomerular basement membrane between what, between podocytes and endothelial cells of a small blood vessel, between the podocyte and the endothelial cells of a small blood vessel. There is a glomerular basement membrane. Thickening of this glomerular basement membrane, it's called what, membranous. So it's called membranous nephropathy. But if it's a membranoproliferative, this means hypercellularity of the glomeruli. But if it's membranous only, so affection of glomerular basement membrane, thickening of glomerular basement membrane, so it's called membranous. Then the next one, it's a primary glomerular disease or secondary glomerular disease. Primary from the glomerulus, so it's what, primary disease of the kidney is specifically impacting what, the glomeruli. So it's a primary from the glomerulus, so it's called what, minimal change disease. This is so important and we will speak about it. Secondary glomerular disease. What's meant by secondary? Secondary to another disease, systemic lupus or diabetic nephropathy. So systemic disease or disease of another organ system that also impacts the glomeruli. So it's a systemic disease or disease of another organ. So we have systemic lupus erythematosus and diabetic nephropathy causing what, secondary glomerular disease, but primary from the glomeruli itself. So there is what, minimal change disease.